I wanted to start my presentation today with a little bit about what being a Bevan exemplar has been like for me. So I was and still am very lucky that I had a lot of support for my idea from my clinical lead. So I didn't need the clout that Bevan provides to get ideas off the ground, luckily. But that said, it's been an amazing experience, and my skills in networking, negotiating, planning and communicating my ideas have definitely improved. For those listening that aren't in the Bevan Commission fold, there's a lot of wearing hats involved. This is Sean wearing a hat. And a task that kind of haunts me was wearing this particular pink hat with my back to a group of relative strangers at that point, listening to my idea being ripped apart. It was a cruel exercise to teach me that you won't always get full support, but instead lots of tough questions when you try to implement a change, and that was a really important learning point for me. Wearing an exemplar hat also gives you space to explore and develop your idea, as well as maintaining focus and motivation. So to give you some background to my project, firstly, if you don't know much about pulmonary rehab, it's fantastic. It's an exercise and self-management programme for people with chronic lung conditions, and the benefits and efficacy of it are well documented. In Swansea Bay, we have generic rehab programmes for which most attendees have COPD, and we also have a condition-specific programme for people with interstitial lung diseases. We're a multidisciplinary team, so our service users get access to respiratory nurses, physiotherapists, occupational therapists, dietitians, exercise instructors and support staff. Now, bronchiectasis is a chronic lung condition, but if you only have bronchiectasis, you don't meet the criteria for our pulmonary rehab service. If you have bronchiectasis and a bit of COPD, you can come along, although the majority of the education you get will be focused on your COPD. So what do people with bronchiectasis get? Well, if you're under the care of a consultant, you get clinic appointments and access to a respiratory physio within that clinic, but no other allied health professionals without a specific referral and the associated waiting list. And if you're under the care of your GP, you get your GP when you need them, but that's it. Now, for people with bronchiectasis, self-management is vital to augment disease progression, maintain quality of life, prevent infections, and the need for burdensome antibiotic treatments. So I thought, why not give these people a really in-depth self-management programme delivered by an MDT that already have the knowledge and skills to do this, and get them exercising along with it, because exercise and being active helps everything. I did a little bit of training on bronchiectasis to upskill the team and had discussions with the professional leads on the team regarding education topics, and we were ready to go. As a starting point, we touted for business from the consultant-led clinics. Now, I got asked why an awful lot. So why can't they go to a generic pulmonary rehab programme? Why do they need a programme all for themselves? And flashbacks now to the wearing the hat situation where everybody was ripping my idea apart. But I feel really passionately that they do need a service of their own. So this is a quote from one of our feedback forms, and it's my absolute favourite. A lady actually said at the end of the programme that she didn't feel ill anymore. And people can live really normal lives with bronchiectasis. Work and family life can be manageable alongside the condition, and understanding the diagnosis of this is the start of it. So we take time to teach people about their condition and how to pronounce it. So many people don't know how to say bronchiectasis after a 10-minute consultation to say this is what's been causing all your symptoms, and that can have a really damaging effect on patients to have something that they can't actually tell other people about because they can't say the word. People with bronchiectasis also think they're the only ones with it. We don't hear about it in the news like we do with COPD, but the incidence is increasing with better diagnostic tools and is more common than people think. Knowing what your symptoms are and what is normal and how to control them has a huge impact on quality of life, because if you know about them and understand them, then you don't worry about them as much. And if you know how to suppress your cough, for example, when you're in the theatre, then you can enjoy going to the theatre. And now that's something that can be a big issue for people. And if you don't know what your normal symptoms are, then you can't recognise when you're becoming unwell. So knowing when you're becoming unwell can lead to recognising that and implementing a self-management plan, which is something that we did for everybody that came to the pulmonary rehab programme. In September 2019, we started our first bronchiectasis specific pulmonary rehab programme. We started with 7. One person only attended the first week because they had a fall at home, so couldn't come to the rest of the course. But the other 6 people completed. Another 6 in a different cohort were due to finish in April 2020, but lockdown brought that programme to an abrupt end, unfortunately. But of the course that did complete, 4 out of the 6 had improved exercise tolerance at the end of the 6 weeks. 1 stayed the same, and they had a musculoskeletal condition that limited their mobility, so that was to be expected. And the other one decreased, but we think that they had really taken on board the planning and pacing of activity advice that we'd given, and it was very difficult to get them to go any faster, but I think they probably could have at the end of the course. So 5 out of 6 people improved in the Bronchiectasis Health Questionnaire and the Leicester Cough Questionnaire, which both measure symptom burden. We did a 9-month follow-up, and we were very pleased to find that 3 out of the 6 people that completed had maintained some of the improvements in these scores, which, given the situation at the time where we were coming out of lockdown, and they'd obviously been shielding, etc., I thought it was a really positive result. And at 9 months, all but 1 had avoided hospital admissions or any exacerbations at that point. 1 had unfortunately become unwell with a lung-related issue and needed a hospital admission the week that we contacted them. So looking at what would happen next, so I hope we can reinstate the programme after the new year, COVID permitting. We have trialled a socially distanced group with COPD patients, which actually proved that it was possible in practice. And we have referrals for the bronchiectasis specific pulmonary rehab programme ready and waiting to go when we can start it back up. The aim would be to provide it in other locations across the health board on a rotation basis, so it's available locally to people. I'd like to find out what is most helpful for patients from an education perspective, and collect information on that, possibly extending from a 12 sessions over 6 weeks to 16 over 8 weeks to recognise further exercise tolerance achievements and include more topics or revisit pertinent topics in the extra sessions. And looking at what an education package for bronchiectasis should look like is one of the areas for further research highlighted in the 2019 British Thoracic Society guideline for bronchiectasis. So I'd love to be able to share some ideas around that as a poster presentation next year. I'd hope to educate primary care staff about the programme and accept referrals for those being managed in primary care who are only getting their GP's input other than that. And of course, continue evaluating what we do. And I put brace ourselves because bronchiectasis has been highlighted as one of the possible long-term consequences of people that contract COVID-19. So there's the potential that we could, in the future, very much need a self-management programme for this group of patients. So I'm going to stop talking, and hopefully if I can manage this swapping this screen, I would like to share with you a patient's perspective on attending.
Hi, I'm Jo and I'm 48 years of age, and I was diagnosed with bronchiectasis at the age of 41 in 2002, and I work for the NHS. I wasn't really told a lot about the condition, only that the airways of the lungs are abnormally widened. So I searched the internet after the appointment to explore what this was all about. I know we were told not really to do this, but I had to find out about being diagnosed with this condition. It was quite frightening and didn't really know a lot about it. I could see myself on a nebulizer or on long-term oxygen, which was really quite frightening. I attended the respiratory nurse-led team, and I was then transferred after a few months to respiratory physios, and then we discussed my condition, and I was prescribed an a cappella device there, which keeps my lungs clear of mucus and helps me breathe much easier. I wish I'd had this from the start, as I think it would have prevented me from taking antibiotics and steroids. I was then referred by the physios to the pulmonary rehab team, which includes nurses, occupational therapists, dietitians and physios. I was assessed at the beginning of my fitness levels and was seen by all the team and was told what the programme was all about, and then they compiled an exercise plan for me after the initial meeting. I haven't attended a gym in many years, probably in my 20s. I didn't really know what to expect. Could I do it? Was my chest going to be okay? Would there be anyone there my age? But really, I thought at the end of the day, we all have the same condition, so really age didn't come into it. We firstly did a warm-up with Matt, the nurse instructor, before going upstairs to the gym. And after attending the gym, we had a talk every week regarding many topics, which was so informative and interesting and very relevant to our condition. These included bronchiectasis and how to treat it, relaxation techniques. We were then given CDs to practice this at home, which I know a lot of us did, mood management, healthy eating and different types of medication, and how important exercise is regarding our health. All of these topics were welcoming to me, as I had waited 7 years to learn about my condition. At the end, we were given a post-assessment, and I do think that my fitness levels improved. I felt less tired than I had been, and then was given the opportunity to join the gym as part of the nurse programme, and a few of us did. Unfortunately, with COVID, the gyms have been closed, but I have been doing a lot of walking to keep my fitness levels up, and I have learned so much about my condition and ways to treat and manage it, and have become fitter in the process, and it's really all thanks to the pulmonary rehab team.